For the patient, we've done some internal research ourselves. We do see things like better adherence to home programs, better adherence to plan of care. So in 480 patient analysis, we found that patients on SARA had a between 19 and 62% increase in completion of plan of care, right? So they're not giving up. They're not getting to visit number two, be like, I'm sore, this isn't working, and I'm out. This is just not happening as much. And so you have the clinical outcome, right? But we've also seen patient satisfaction increase. And the way that it works, it's kind of like this flywheel. The patient engages and gives some level of data to the provider. Now, the provider has that and can now have a more efficient and meaningful visit, but especially the subjective. Like your subjective should be done by the time the patient walks in the door, right? And so you're not asking, hey, Demi, how's it been going since we last saw each other? It's, hey, Demi, I see that your pain has gone down. You've been good with your home program, but the stairs are still giving you trouble, right? Like, and that's the first statement. Like that's where you start. And so now as a clinician, I know what's going on in between visits and my patient is being more adherent. And then the practice generates high margin revenue. If you generate an extra $200 a patient, but you're only keeping 5% of that, like it matters, but it doesn't. Now, if you're generating 100 and you're keeping 70% of that, that starts to really matter because if you're on average netting about, let's just say $150, right, in an episode, and you're netting $150 on your normal, your visit codes. If you add $70 to that, going from 150 to 220 is almost a 50% increase in bottom, like that's bottom line.